I'll be presenting today's Radiopedia.org case in radiology, ovarian collision tumor. Case courtesy is demonstrated here, and the case link is in the description below. Presentation: we have a 30-year-old female presenting with abdominal pelvic pain and progressive distension. On CT, we see a huge cystic lesion with an enhancing solid peripheral component at the right anterior aspect and areas of fat densities and focal calcifications at the inferior part. The cyst arises from the pelvis and extends superiorly until the level of the pancreas. The right ovary cannot be defined separately from the mentioned cystic lesion. The patient underwent surgical excision of the abdominal pelvic mass, and histopathology evaluation confirmed an ovarian collision tumor. In this case, the coexistence of teratoma and mucinous cyst adenocarcinoma. Ovarian collision tumors are an uncommon ovarian neoplasm where there is coexistence of two adjacent but histologically distinct tumors in an ovary with no histologic admixture at the interface.